A 46-year-old man comes to the clinic with daily production of large volumes of thick, malodorous sputum. He says he's been often sick several times since his late teens, often requiring hospitalization. He says he's had worsening shortness of breath on exertion. Physical examination shows digital clubbing and crackles over both lung bases. A chest CT shows dilated airways with lack of normal tapering. Which of the following description best fits the most likely condition this patient has? Choice A, permanent dilation of bronchi and bronchioles with obstructive mucus plugs. Choice B, damage to the lungs from chronic aspiration of gastric contents. Choice C, centrally located growth in the lung which stains positive for keratin. Choice D, reversible episodic bronchoconstriction caused by immune cells. Choice E, infection by an acid-fast intracellular bacteria. Or choice F, lack of protein which prevents proteolysis by other enzymes. I'll wait for 5 seconds, then start answering the question. Now, when you first read this question, many of you might seize on the implication made by this question that he's had essentially recurrent pneumonias, and you start thinking about things like cystic fibrosis and Cartaginer syndrome, or even IgA deficiency. But for the purposes of this question, it's actually not important because, yes, he's had recurrent infections, but we're not here to ask you why he's getting those. We're asking you, basically, what is a sequelae of him getting these over and over? What you want to seize on here instead is that the question is telling you he's coughing up lots and lots of thick, foul-smelling sputum. Usually when the step exam is telling you this, they are trying to push you towards bronchiectasis. So that's why choice A, permanent dilation of bronchi and bronchioles with obstructive mucus plugs, is the correct answer. So whatever is causing his chronic infections, like we said, it's not important for this question, but over time, that's going to damage his lungs. It's going to cause permanent bronchial dilation, impaired clearance of mucus, and therefore classically it will present as a patient coughing up lots and lots of foul-smelling sputum. That's not to say that these things are impossible to see on any of these other answer choices. It's just that when you see lots and lots of foul-smelling sputum, you should be thinking bronchiectasis on USMLE. So let's take a look at some of these other answer choices. Answer choice B, damage to the lungs from chronic aspiration of gastric contents. That's mostly implying aspiration pneumonia, but typically vignettes aren't going to describe it with dilated airways or clubbing. Choice C, centrally located growth in the lung which stains positive for keratin. Well, that's squamous cell carcinoma. This patient doesn't really have most of the risk factors that you would associate with squamous cell carcinoma. And just another thing I feel like noting here is that squamous cell carcinoma on step exam, they really like testing it with its paraneoplastic syndrome, which is usually them showing you hypercalcemia and bone resorption because of secreted PTHrP. Choice D, reversible episodic bronchoconstriction caused by immune cells. Well, that's just asthma. Not much to say there. Choice E, infection by an acid-fast intracellular bacteria. Obviously, this is tuberculosis. TB can cause bronchiectasis, but it's just that it's probably better to just pick that answer directly if that's what you were thinking. Not to mention that this patient doesn't seem to really have any of the risk factors. They didn't say he has a history of travel or anything like that. And his symptoms don't really fit either, right? Because he would probably have like weight loss and night sweats, that sort of thing. Choice F, lack of protein which prevents proteolysis by other enzymes. That's alpha-1 antitrypsin deficiency. They probably give you a family history, elevated liver enzymes or something, and you would have COPD as well. Recurrent infections isn't really typical of alpha-1 antitrypsin deficiency. So I guess the biggest takeaway here is if you see a question that says lots and lots of foul-smelling sputum, clubbing of the fingers and stuff like that, you just start thinking bronchiectasis. I hope this question was helpful, and I'll see you in the next one.